Hello, my name is Taylor Anderson, and I'm grateful for this opportunity to present our group's work on a novel outcome prediction tool for fall-related trauma. As the United States population continues to age, traumatic falls in the elderly have become an increasing burden on the healthcare system. The ability to predict adverse outcomes is particularly important in this population in order to guide goals of care discussions and potentially mitigate harm. Current prognostication tools rely on baseline information about health conditions and functional status, which is not always readily available in the acute traumatic setting. We developed a new outcome prediction tool based on injury pattern defined by ICD-10 codes, which we call Outcome-Specific Injury Scores, or OSIS. Our population was drawn from the 2016 National Inpatient Sample Dataset. We included all patients over the age of 65 who were hospitalized after a traumatic fall. Our total population consisted of 871,000 encounters, which we divided into a 70-30 split of training and validation cohorts. We then identified injury patterns based on ICD-10 codes and measured the association of each with 5 clinical outcomes: inpatient mortality, deep venous thrombosis or pulmonary embolism, disposition to a facility, respiratory failure, and prolonged hospitalization. Associations were adjusted for frailty, age, and sex. We then used ridge regression to define the strength of each association and generate a scoring system that allowed us to classify low, medium, and high risk categories. For each of the 5 outcomes of interest, we were able to identify a unique subset of predictors ranging from 11 to 25 significant associations. Table 1 shows the overall number of encounters, number of injury patterns with significant association, and 3 strongest predictors for each outcome. For example, traumatic brain injury, C2 fracture, and greater than 1 rib fracture held the most weight in predicting inpatient mortality. Femur fracture was a common strong predictor of multiple poor outcomes, which is consistent with previous research. We also noted that increasing OSIS score for one outcome resulted in greater odds of all other poor outcomes. In summary, our research demonstrates that injury pattern can be used to predict risk of specific adverse outcomes after traumatic falls in the elderly. This represents a new approach to prognostication and reduces reliance on baseline or pre-hospital data that may not be readily available in the acute traumatic setting. Moving forward, we plan to develop an electronic application for real-time bedside use that we can then incorporate into prospective validation studies. As with any research, our ultimate goal is to create a clinical impact. We hope that early identification of patients at risk for specific adverse outcomes will allow us to take preemptive, targeted measures to address these risks. For example, integrating automatic OSIS scores into the electronic health record could allow automated workflows such as prioritized physical rehabilitation for patients at risk of disposition to a facility, or aggressive pulmonary interventions for patients at higher risk of respiratory failure. Thank you for your time and attention. We hope that this work will inspire future efforts to improve delivery of care to this vulnerable population.